Hello students, good afternoon. Today we will discuss epidemiology of tuberculosis. The tuberculosis disease is a problem, it's a global problem, not just confined to India, but it is a problem in different other countries. So we will study the agent factors and the host factors and other the transmission dynamics, how it spread from one person to other. So agent, it's Mycobacterium tuberculosis that is responsible for causing tuberculosis disease. It's a facultative intracellular parasite that it can invade the phagocytes and it resists killing and survive within the phagocytes. It's a gram-positive organism. It's a non-sporing, non-motile pleomorphic rod. It's classified as acid-fast bacilli because it retains the carboxyl dye after application of acid or alcohol. It's obligate aerobes and it's a slow grower with generation time of 12 to 18 hours. It's a long generation time because usual bacteria they multiply within 2 to 4 hours, but generation time of this Mycobacterium tuberculosis is 12 to 18 hours. And the virulence, the Indian tubercle bacillus is said to be less virulent than the European bacillus. So the two strains, one is the human and bovine strains. These are important for men. But in recent years, some atypical mycobacteria have been isolated from men, and these atypical mycobacteria they have been classified into four groups. One is photochromogens. An example is Mycobacterium kansasi. Then we have scotochromogens. Example is Mycobacterium scrofulaceum. Then non-photochromogens. That's Mycobacterium intercellular. Then rapid grower. That's Mycobacterium fortuitum. So now the source of infection. Source can be a human source or a bovine source. The bovine source of infection is usually infected milk, and it is not a, it's not a major problem here in India because usually we people boil milk before consuming it, and so the focus is on human source. The most human source of infection is the human cases whose sputum is positive for tubercle bacilli and who has either received no treatment or has not been treated fully. So we have the two condition. One person who is suffering from tuberculosis, that means having the sputum positive case and has not received any treatment till date, he can be a source of infection to others, or another person who is on treatment but has not been fully treated. So even a patient who is on treatment but not fully treated is still a source of infection to other people living in the closed vicinity. Okay. So communicability. So patients are infective as long as they remain untreated, and an effective antimicrobial treatment reduces infectivity by 90% within 48 hours. So just to see how, I mean, you have to start treatment and then within 48 hours, this infectivity reduced by 90%. So how much effective is antimicrobial treatment? Just you can imagine. Now moving to host factors. First is age. So tuberculosis affect all ages. In developing countries, they are now showing a sharp rise in infection rates from childhood to adolescence. Even in India, the majority of the sufferer are now in elderly age group. Those tuberculosis cases, they belong to elderly age group, and same is in the developed countries. Sex, it's more prevalent in males than in females. Heredity. So tuberculosis is not a hereditary disease. However, some studies, twin studies, they have indicated that inherited susceptibility is an important risk factor. So inherited susceptibility can be a risk factor, but it's not a hereditary disease. That should be very clear. The nutrition. So malnutrition is widely believed to be predisposed to tuberculosis. Okay, then other disease like diabetes, silicosis, myxedema, HIV infection, or person who is on immunosuppressive drugs, he is susceptible to the tuberculosis. So immunity. So man has no inherited immunity against tuberculosis. It is acquired as a result of natural infection or BCG vaccination. So we can acquire this immunity by two ways. One is by natural infection, another by BCG vaccination. So past infection with atypical mycobacteria is also credited with certain amount of naturally acquired immunity. Then it's now known that both developed hypersensitivity and acquired resistance to tuberculosis are cell-mediated response. So cell-mediated response, this immunity is playing role. Either we have acquired resistance to TB or we have delayed hypersensitivity. So in both cases, there is a cell-mediated immunity that's playing role. Now the important is the social factors. So we had discussed the agents, then host. Now we are focusing on the social factor. So tuberculosis is a social disease with medical aspects. It has been described as barometer of social welfare. The social factors include many non-medical factors such as poor quality of life, poor housing, overcrowding, population explosion, undernutrition, smoking, alcohol abuse, lack of education, large families, lack of awareness of cause of illness, etc. All these social factors they contribute in the development of tuberculosis disease. So mode of transmission. So tuberculosis is transmitted mainly by droplet infection and droplet nuclei. They are generated by sputum positive patient with pulmonary tuberculosis. To transmit infection, the particle must be fresh enough to carry a viable organism. So tuberculosis is not transmitted by fomites such as tissues and other articles used by the patient. So it's not transmitted by fomites. And other route of transmission is intake of unpasteurized milk or a dairy product that is from the bovine source. Then we have other source direct inoculation through the skin. Though they have they cause very less number of cases. Now the final is incubation period. The time from receipt of infection to the development of positive tuberculin test range from 3 to 6 weeks. So 3 to 6 weeks. And thereafter the development of disease depends upon the closeness of contact, then extent of disease, kitni disease kya hai, then sputum positivity of the source, and host parasite relationship. Thus, the incubation period may be weeks, months, or years. So actually, it takes 3 to 6 weeks from the receiving the agent to the development of positive tuberculosis test, and after that, development of disease depend upon certain factors like the closeness of contact, then extent of the disease, and sputum positivity of the source case, that means dose of infection, and the host parasite relationship. All these factors are they are playing their role in the development of the disease. So we discussed about the natural history and the epidemiology. We focused on the agent, then the host factors, and then the social factors, and finally the incubation period. And these are the very important, information regarding the tuberculosis, and you should be very well versed with this basic information and basic knowledge about the tuberculosis. So in the coming lecture, we will focus on the preventive aspects of the tuberculosis. Thank you. Have a nice day.